Hi, this is Anna. I'm going to demonstrate the WatsonScaphoidShift test as well as the GamekeepersThumb test. This is my volunteer. He has consented to be in my video. Thank you. So let's start with the WatsonScaphoidShift test. So this test is a test for scaphoid instability. Now the scaphoid bone is not on the distal but rather on the proximal row of carpals. In order to locate the scaphoid bone, I'm going to first locate the anatomical snuff box. So please move your thumb up like that. Good. So right here it is. So go ahead and relax. So I can verify that this is the distal metacarpal. Deep into the anatomical snuff box is the trapezium bone, and just proximal to that is the scaphoid bone. So what I'm going to do is position one hand on the scaphoid bone, passively move my patient into ulnar deviation and extension, and then move them into radial deviation and flexion. The test is positive if the patient reports pain or if there's an audible clunk to the carpal bones here at the scaphoid level. This test has reported sensitivity of 69% and a specificity of 66%. So basically this test, the WatsonScaphoidShift test, does not really have good diagnostic or screening capability. Its reported positive likelihood ratio is 2.0, which means that if the test were positive, then you really have only minimal probability that the patient does indeed have scaphoid instability. The negative likelihood ratio is 0.47, which indicates that if the test were negative, that's not a good value. So you really can't make any conclusions on whether the person actually has scaphoid instability based on that particular negative likelihood ratio. The next test is called the Gamekeeper's Thumb, also known as the skier's thumb. You're testing for instability of the ulnar collateral ligament right here of the thumb, not of the wrist, the ulnar collateral ligament, but of the thumb. This ligament is commonly injured during blunt trauma forced when the thumb is in extension. Usually when a person is holding onto a ski pole and they go to fall and their thumb goes into extension during forceful translation of the ski pole. So for anatomical reference, this is the radius and this is the ulna. So on this side we have the radial collateral ligament of the thumb versus this is the ulnar collateral ligament of the thumb. So to test this ligament, I'm going to put a valgus force. The thumb is going to be in neutral alignment. I'm going to put a valgus force on the radial aspect of the thumb, and if there is greater than 30 degrees of valgus translation, then that would indicate instability of the ulnar collateral ligament. Reported sensitivity values for the Gamekeeper's Thumb test is 94%, which indicates that it's an excellent screening test. However, there is no reported specificity or likelihood ratio values for the Gamekeeper's test.